Hello everyone. Before we start today, I want to acknowledge with respect the Indigenous peoples and communities whose historical relationships with the land continue to this day and on whose traditional territories our work takes place. While we meet today on a virtual platform, we can take a moment to acknowledge the importance of these lands, which we all call home. My name is Autumn Sipis. I'm project manager with the Canadian Coalition for Green Healthcare, and on behalf of the Coalition and the Canadian Association of Pharmacy for the Environment, or CAPhE, I would like to welcome you to today's webinar, A Hospital Pharmacy Framework for Climate Resilience in Canada. Throughout the event, please use the chat function for any technical issues you may be experiencing. Use the Q&A function for any questions you have regarding the presentation, and our panelists will be answering questions at the end of the event today. We are also recording this presentation, and the recording will be sent to all registrants and be available on our YouTube channel at a later time. Presenting today, we have Dr. Shaliza Sejwani. Dr. Sejwani is a pharmacist who works within areas of oncology, climate change, and global health as they relate to the pharmacy profession. She is currently an adjunct professor at the University of Ottawa, where she works on the incorporation of planetary health and pharmacy within the pharmacy curriculum. She serves as the national co-chair of CAPhE, which partners with major climate health and pharmacy-based organizations for advocacy and education within planetary health and pharmacy. She is also the co-founder of Climaceutics, I hope I'm saying that right, Health Solutions, which focuses on building on tools and certifications for pharmacies to reduce their emissions and improve their climate resilience. Take it away, Shaliza.
Amazing. So thank you so much for that kind introduction. So it's lovely to see all of you on the call. And this is a particularly exciting area right now. I remember first doing a presentation on hospital pharmacy and planetary health, I think 3 years ago for the coalition. And since then, so much has grown. CAPhE has grown, the coalition has done some amazing work. And the field as well has grown in such beautiful ways. There have been some amazing work done by so many different groups. The Canadian Pharmacy Association has done some great work on planetary health, the Canadian Society of Hospital Pharmacists as well, Cascades, many other groups who together are helping to move this area forward. I wanted, what is the context for this presentation in particular? We are starting to see a lot of education in the pharmacy and planetary health space. And it's exciting that this is now a mainstream topic rather than something that kind of 4 years ago, we would talk about this as if it was a topic that was kind of still, very few people knew about it. And now, because of the work of so many of the different people that groups that I've mentioned, including the coalition and CAPhE, a lot of these, this is now becoming very much mainstream. But in order to be able to continue it to be mainstream, and in order for it to be sustainable, we often talk a lot about how do you then incorporate this from an operational resilience or an operational framework perspective and an operational excellence perspective. And, I've been very lucky to spend a lot of time in hospital pharmacy over the last 10 to 15 years. And, we've been very lucky to have other hospital pharmacists help out at all levels to be able to help create this framework. And also joined by a physician who has done a lot of work with, who's basically represents the coalition representation as well. So if we keep going forward, one thing I want to note is that this is for low carbon and climate resilient care, and I will explain why in a few moments as well. So where did this start? So we had watched, there was a previous framework that was released that was more for hospital systems as a whole rather than specifically for pharmacy, supported by the coalition. And a lot of the CAPhE board members, we saw this framework and thought, wow, this is amazing. This could be adapted specifically for pharmacy because there is a need to help basically inform and support a strategic level work as well. So helping to shape basically strategic recommendations. So all of the board members who are hospital pharmacists at CAPhE came together and helped to shape this framework. These are kind of my standard slides that I often present at a 101 Planetary Health 101 lecture. But I just want to quickly review a few of the topics that we typically see within hospital pharmacy within emission reduction. We often see a lot of work on thinking about areas like anesthetic gases and inhalers. Many of you may know that, for example, using desflurane for an hour is the equivalent of driving a car more than 300 kilometers. Inhalers, MDI inhalers, also have a very big emissions footprint as well. And there's been a ton of work in both of these areas for inhalers, all the way from looking at how do you reduce inhaler wastage to clinically appropriate, exploring clinically appropriate options for facilitating switches to looking at how do you have dry powder inhalers, specific inhalers approved on the formulary, to advocacy efforts that we have been involved in as well at CAPhE, helping to take away helping to advocate on taking away limited use codes for certain dry powder inhalers. Medication waste reduction has been a really, really big topic as well, looking at trying to reduce unused medication waste in particular. We've seen this discussed by many hospital pharmacy green teams, including the one that the Ottawa Hospital specifically, which I attend, has had looked at as well, supported by a Canadian Society of Hospital Pharmacists grant. There are also opportunities to look at deprescribing and social prescribing, and a lot of this, interestingly, is very parallel to what we would do as clinical pharmacists in the first place, but also have a really nice planetary health component as well. And of course, sustainable procurement. We have our lovely group purchasing organizations who are doing some great work in that space as well, looking at environmental sustainability there. I've mentioned the anesthetic gases and the alternatives to MDI inhalers, but now I also want to switch to climate adaptation because, now we can see that the climate crisis is actually here. It is no longer a future issue. It is no longer just a low-income country issue. It is here. Some separate work that I've been focused out on outside of hospital pharmacy has looked at actually the impact of community pharmacy closures related to extreme weather events for days, weeks, and even sometimes months at a time. Now, within hospital pharmacy, we are also starting to see impacts as well. And the most severe impact that I can think of that happened a couple of years ago, which was an entire evacuation of a hospital, which was, of course, in Yellowknife. But even across the country, we are starting to see impacts of extreme weather events, but also, things like extreme heat to the patients that end up going to hospital for acute care. So because of that, we have to think about disaster planning recommendations, and we also need to think about, what is the impact of climate to things like cardiovascular disease, to things like infectious diseases, to things like mental health, to things like oncology. And of course, through all of this, in a world that is also being shaped by tariffs, we also have to think that extreme weather events can certainly impact supply chain, and we need to think about shortages. So some examples about this include, certain events that affected, for example, the availability of Baxter IV bags, supply of epinephrine a few years ago. But this is becoming more and more and more common, where you have extreme weather events hitting at various parts of the world, and including Canada as well. And then that also impacts your drug shortages too. So at CAPhE, we currently have a student looking at, the impacts of climate shocks on the entire drug life cycle, from the medication being in drug development all the way till the medication coming to the patient. And you may have seen this diagram as well. This is actually by the CDC. And you can see that, emissions impact everything from extreme heat affecting cardiovascular disease, morbidity, and mortality. You can see infectious diseases being impacted. I came into the planetary health space after working a lot in global health, and I remember seeing a diagram of infectious diseases like malaria, basically creeping up a mountain in East Africa because there were certain times where, a mosquito wouldn't like, would not necessarily the previously the mosquito wouldn't have necessarily done well in certain environments, but now since because of heat and because certain areas up the mountain was actually being it was more available for the mosquito to proliferate, that basically meant that malaria was coming with it. And then, of course, in other situations, you may have situations where it's so hot that a particular, it's even hard for the mosquitoes to survive in the first place. So it is important to keep an eye on all of these things because even within Canada, because the changes in temperature and the changes in heat and the changes in precipitation specifically as well are also impacting emissions. Are also impacting health, and those impacts to health are impacting, what our patients are admitted with. So they also impact, you also have an impact on access to care as well. So both access to primary care, but also access to hospital care too. And then you have an impact with extreme heat affecting medication management as well as the medication integrity in the first place. So if we think about disaster planning, then, with hospital pharmacy, often, a hospital pharmacy will have its own disaster plan. But it's a really good idea to ask as to, how in detail is this disaster plan? Does it talk about what happens when there is an extreme weather event or when there's any event? And what are the procedures with regards to communication with staff? And communication with patients. How are patients informed? What are evacuation procedures? But also like other, what if you were, for example, to not be able to provide certain services? How would patients be informed? Now, a lot of this has also been informed now through the COVID-19 pandemic. So disaster planning has been strengthened in that area from a public health perspective. But there are also other types of disasters that can happen. And talking to disaster planning experts is very helpful here. So one key area that I'm very passionate about is electronic medical record outages. There was an ISMP publication a couple of years ago showing that, when you had an electronic medical record outage that happened related to a power outage or related to anything else, you would have a higher risk of medication errors. And that is very understandable because if you think of a medication like vancomycin, let's say you had a patient on vancomycin and the EMR was working, and then suddenly you didn't have an electronic medical record and you weren't sure to when to give the next vancomycin dose. And then, the EMR goes back on, and then you're wondering, okay, well, there are new nurses, there are new pharmacists. You're trying to figure out where the vancomycin was given previously. So everything from allergies being flagged to medication timing to how can you make up a very complicated chemotherapy with difficult volumes when you don't have an electronic medical record. All of that becomes really important and can actually increase your risk of errors. So having very strengthened planning is really important. And in fact, I'm particularly impressed now with HSO, which is the body that represents Accreditation Canada, for actually having a new disaster planning committee that has several different people on it, including from the coalition and from CAPhE, so that we can continue to strengthen our disaster planning. But they also have a specific focus as well within climate resilience, which is really exciting. In terms of heat and medication management, CAPhE and the Canadian Pharmacy Association came up with this with this infographic. Bad clap is a kind of odd anagram, but maybe it'll help you remember it more. Um, so, uh, so beta blockers, ACE inhibitors, diuretics, anticholinergics, lithium, antidepressants, antipsychotics. So if you were to think about this instead of trying to memorize an anagram, if you were to think, okay, if it's really hot outside, what does that mean for my patient who's on an ACE inhibitor, where there's a lot of potential renal function issues? What does that mean when a patient is on a medication and they're not able to sweat because of that medication properly? What does that mean for medications that have a really low therapeutic window, like lithium, where if the dose is a little bit too high, it sends the patient into toxicity? And what does that mean if hydration were to change? So a lot of this is important to think about when, it's now March. We're going to be in the summer very soon, and so sometimes the springs are also getting warmer and warmer as well. So very, very important to think about medication management as well. Wildfires is another area that we've worked on. So just providing some counseling points to pharmacists to provide to patients with regards to wildfires and medication management as well. So just a quick thing here. So as Miles mentioned, we need to think about disaster planning wherever we are. There are some patients who are that we need to think about from an equity perspective. So anybody with chronic illness, think about all of those patients that I mentioned, all of those areas of health that I mentioned earlier, your cardiovascular disease, your oncology, your respiratory disease, all of these areas then get worse when you have a climate hazard, so heat with cardiovascular morbidity and mortality. Think of your asthma patients and your COPD patients in a wildfire, or even with wildfire smoke. Your rural populations, think about what happens when the only highway that goes next to a population is basically interrupted, um, and like what happens to the access of medications for that particular hospital pharmacy. What happens to how patients can get to the hospital? There's so many different factors that are then implicated, including within pharmacy as well. So I'm going to just quickly go to the next slide. If you can switch slides. Yeah, thank you. So the great news is that there is education out there. So many different groups now have put some amazing education. CAPhE has worked with a bunch of different organizations to help create education. One particular area of education that I was impressed with was the CSHP Cascades Hospital Pharmacy Playbook. The coalition has guidebooks available for specialty areas as well that are available on their website. So really, really important areas. And also, we need to start thinking to kind of complement all of this existing work that's there for individual hospital pharmacists and managers, how to continue to integrate this within a strategic planning perspective. So if we were to go to the next slide. Now what we're starting to see is that individual hospitals are starting to think about both climate mitigation and climate adaptation. You have your green teams, for example, that are existing on these environmental sustainability committees that are there on a hospital level. And then you also have this wider global strategy, which actually the WHO has put out a low carbon and climate resilient framework. So you'll see I said low carbon and climate resilient, meaning that both areas are basically incorporated together. You're starting to see things like HSO coming up with a climate action advisory committee, and then also a disaster planning committee as well at the same time. And then that informs Accreditation Canada hospital standards. So very important to have pharmacy integration in both of them, which they also have as well. So if you were to go to the next slide, it's then very important to think, okay, we have this WHO operational framework, and you can see it's an operational framework that discusses both low carbon and climate resilience with regards to everything from leadership and governance, to thinking about workforce, to looking at research. And you can see that part of this framework talks about your low carbon, and then the other part also talks about climate resilience, and it's actually both joined together. Um, and this is very helpful from a global framework perspective. And the International Pharmaceutical Federation has also put out now a policy that complements this nicely, talking about recommendations for hospital pharmacy as well. But if you were to go to the next slide, now it's a good idea to think about how does that then get integrated on a like on a hospital level. Well, one exciting thing is we're starting to see certain institutions actually look at both low carbon and climate resilience together. So if you look at Fraser Health, I just basically copied this from the Fraser Health report. And you could see their strategic priorities actually talk about emission reduction, but also climate resilience in the same breath as well. And so their strategies actually then reflect this. If you were to go to the next slide, now one big question we have then is, well, then how do we do this on a systemic level through hospitals? And I was just kind of updating myself on all the different types of work that's out there, and I came across this amazing article titled "Climate Resilient Acute Care Operations: A Framework that Informs How Operations within Acute Care Build Climate Resilient Frameworks." And this was actually published by a group of individuals, one of whom is Pavani Goel, who works within the coalition. And so this work was supported by the coalition. And it actually had some really key important areas of leadership and governance, healthcare system strengthening, healthcare service delivery, climate research. And interestingly, when we were going through the recommendations in the strategic framework, mind you, this was for all of the entire hospital, not specifically pharmacy, but literally a strategic framework for the whole hospital. We started realizing as CAPhE that, oh, wow, this actually models really nicely with what one would do within hospital pharmacy. And we always talk about multidisciplinary work. What better work could we create if we were to actually, model hospital pharmacy strategy around the existing strategic frameworks that are actually now being piloted for rolling out. So if we were so this framework was called the CRACCO framework, which is the one that Bhavini and her colleagues, Dr. Goel and her colleagues, rolled out. And if you go to the next slide, you will see the results of this framework. So I know the text is really small around. We have another version of this that is actually on the coalition website, on where you can actually zoom into the text. But before we get to the text, I want you to actually look at the actual categories. So you can see the categories of leadership and governance, healthcare system strengthening, service delivery, quality improvement, and education, research. And you can see all of the different subcategories all around that. And again, remember that this is for the hospital as a whole. And this is a way for then hospital leadership to be able to go through these different recommendations and check off what they're actually doing and actually rank how they're doing in different areas. If we were go to the next slide, we again then saw this framework and thought, okay, we would need to think about in order to think about how do you model hospital pharmacy around this, because there's a nice complement, we would need to have representation from the director of pharmacy level to people who have been involved in project management within pharmacy, to people who are ground pharmacists. And ironically, we were really lucky to actually have all of this in terms of the hospital the CAPhE board leadership represented a lot of these different groups. So what we decided, again, is to create a framework that is modeled around this existing CRACCO framework that had been supported by the coalition. And luckily, we were able to also get Dr. Goel or Bhavini's also on that framework as well, on our new framework in terms of authorship to provide some guidance. So if you go to the next slide, you'll see now our framework. And I think the text is probably even smaller, so not to worry about trying to read that. I just wanted to show you, just if you were to just look at what's in the cycle, you'll see actually that the categories are exactly the same: leadership and governance, health and climate research and quality improvement, healthcare service delivery, and healthcare system strengthening. And then all the subcategories are also exactly the same. This is exciting because that means that each of these categories and subcategories actually model themselves perfectly for the adaptation to hospital pharmacy as well, within both low carbon and climate resilience. Next slide, please. So I'm going to just quickly go through each one. For the purpose of time, I will kind of speed through some of these things. But if we look at leadership and governance and look at the categories there of executive sponsorship, local sponsorship, and capacity building, if you were to go to the next slide, you'll see that within each of these, we've actually started some things to think about. So we've created all of these four different lines. So in capacity building, we're talking about the training of pharmacy professionals, so the technicians as well as pharmacists in both mitigation and adaptation. In terms of local sponsorship, you're actually thinking about, your appointing of pharmacists and technicians as champions with dedicated time, and the creation of your green teams is also there. But then also executive sponsorship. So thinking about a wider hospital plan and making sure that the pharmacy strategic plan is actually embedded within that. So your executive sponsorship is more about that connection between the pharmacy specific strategy, but incorporated within the executive strategy as well. So if you go to the next slide, you'll see an example of that, where with interior health, this is basically an example of their roadmap, and you'll see that within their roadmap, they have specific strategies that are incorporated for pharmacy specifically. So this is where you have executive sponsorship corporately for a hospital pharmacy initiative, rather than just a ground up approach. You also have a top down support as well. If you go to the next slide, please. Training is a little bit different than education. On an education level, for specific pharmacists, of course, there are a lot of really great resources out there. But for training, it would be great to think about, what happens when you have a pharmacy technician who's working in the hood, or a pharmacist who's working in antimicrobial stewardship, or one that's working in medicine. How do the training procedures actually get adapted to incorporate information on environmental sustainability, but also climate resilience? So a really good example for this is that a pharmacy manager should probably have some training on disaster planning, as well as how planetary health can support existing efforts clinically, as well as to reduce costs too. A pharmacy technician working in SIVA should understand things like, potential reductions in pharmacy pollution, as well as emission reduction as well, and some potential considerations within climate adaptation. So training can actually be shaped in order to have systemic change as well. If we were to go to the next slide, please. You'll see the next section has healthcare systems strengthening. So that includes considerations for technology, preparedness, monitoring, and waste and procurement. And remember, you're thinking about low carbon and climate resilience. So if you were to go to the next slide, you will see that within technology, we're already starting to see technology use within the monitoring of medication wastage and medication utilization patterns. And you'll see specific types of pharmacists who are actually very much involved in this and have looked into this from a research perspective too. But you'll also see adaptations of technology for thinking of areas of disaster readiness and supply chain transparency. So you can use technology, for example, to look at how resilient your supply chain is in terms of monitoring for trends in drug shortages. And there are groups of people right now that are specifically and focused on that area of looking at impacts of drug shortages and looking at areas of resiliency. And then, of course, there are drug-specific technologies to reduce emissions as well. So There are certain groups that are trying to look at, how do you build MDI inhalers that don't have these propellants that have a nasty emission footprint, or at least a lower volume propellant. So a lot of different things that are happening in different areas, but all that are very relevant to hospital pharmacy. Next slide, please. So an example of this is a publication, an older publication that actually looked at, wastage reduction and actually creating a workflow management system in order to reduce the amount of waste that you have for a hospital. And of course, this is really interesting from a technology perspective, but it also reduces emissions, but also reduces costs at the same time. Next slide, please. So in terms of climate preparedness, so this is again under healthcare system strengthening. For climate preparedness, you are now starting to think about pharmacy and medication specific considerations for wider institutional emergency planning. And here it's very important for wider emergency planning groups to incorporate specific considerations for pharmacy. So having that connection between the pharmacy department as well as wider emergency planning groups is crucial. So having this strong communication and collaboration really helps to ensure that medications can come to our patients. In fact, actually having a resiliency assessment scorecard to track progress is really, really helpful, specifically for pharmacy in areas like what happens when there's a power outage, what happens to the refrigeration, what happens to EMR, what happens to how pharmacists would communicate with nurses if you don't have those handy Epic messaging. So all of this is really important, and I'm quite excited about HSO because now what's happening is that you actually have hospital pharmacists who are sitting on these committees talking to groups that are focused on emergency planning as a whole and and people from other disciplines like physicians and nurses to be able to help shape some of these eventual criteria as well. Next slide, please. So an example of some challenges from a preparedness perspective with regards to pharmacy and medication specific considerations involve some of the things that I talked about with regards to EMR outages. And in fact, ISMP had put out a medication safety bulletin around this, showing that there were issues when you had EMR outages, and that could lead to medication errors. Now, in response to several hospitals have now focused on their code gray procedures. If we were to go to the next slide, you can see that as well, from an inventory perspective, there was a publication in 2022 about hospital pharmacy strategy around disaster preparedness for drug procurement. And it's very important to think of things from this lens because this is a way that you're actually able to look at inventory management from a lens of, okay, not just what can meet our day-to-day requirements, but also what is important to think about with regards to prioritization in a disaster setting and how can that inform planning for inventory management. Next slide, please. So for monitoring, you can see resiliency and sustainability considerations here with regards to monitoring of medication wastage and inhaler and anesthetic gas emissions, but also considerations for climate adaptation as well with regards to monitoring for drug shortage management, but even things like medication monitoring in heat waves as well. If we were to go to the next slide, you can see some examples of this. So I've shown the CPHA CAPhE diagram here, but also, the Ottawa Hospital had looked at opportunities for inhaler, inhaler workflow processes and looking at opportunities to basically reduce waste here of inhalers. And of course, if we're able to reduce waste of inhalers, then you're actually able to also look at opportunities to reduce emissions. And we had also seen that, reducing waste by unused inhaler waste by even 20% would save a huge amount of emissions and also save costs as well at the same time. Next slide, please. So from a procurement perspective, something that's very exciting is that the two major hospital pharmacy group purchasing organizations, I put both on the slide, have also done a lot of work on environmental sustainability and sustainability criteria in particular within their relationships with manufacturers. And they are both on a journey of looking at how do you continue to improve their sustainability from a procurement perspective, and have created their own strategies as well. Next slide, please. So one thing I wanted to show from the CAPhE CSHP playbook that is specific to procurement is that I was very impressed by this page and by the playbook in general that focused on education, where you can actually have specific areas of potential consideration for improvements with regards to procurement and considerations for both emission reduction as well as pollution reduction as well. Next slide, please. So from a health and quality improvement, like health and climate research perspective, as well as quality improvement, you can see the three different categories there of quality improvement, research priorities, and education. And again, very nice modeling to pharmacy here, where you have your pharmacy green team projects in quality improvement. In research, you have a lot of different types of work on both adaptation as well as environmental sustainability, and then the same thing for education as well. So if we were to go to the next slide, then you can see that for research and quality improvement, CAPhE actually has an intake form on their website because, again, planetary health and pharmacy research is exploding. And we are trying to be able to coordinate and help with preventing of work in silos to actually have intake forms and project repositories that can show some different opportunities for people to work together. So this is on the CAPhE website at caphe.ca. So again, I wanted to show from a quality improvement and research perspective that you have this reflection of environmental sustainability, but also your climate resilience as well with regards to emergency planning, heat, medication management, etc. So if we were to go to the next slide, you can see some examples of this, where you have an environmental sustainability project that was looked at with regards to a Canada-wide survey led by our Ariane Blanc, who is the director of pharmacy at CHEO and also is our director of research for CAPhE as well. And here on the right, you can see some work done by the Ottawa Hospital between 2021 and 2023, looking at various environmental sustainability considerations for green teams for quality improvement. If we were to go to the next slide, you can also see that from a quality improvement and research perspective, you can actually look at heat waves and medication management as well, and trends of this as to how heat waves are affecting heat-related hospitalizations, also related to medications too. So a lot of really exciting work that is happening within the research space. Next slide, please. In terms of vulnerable populations, there's in fact even work done by specific groups on looking at things like the climate emergency and substance use. And for example, what happens when you have extreme weather events, what happens when you have drug shortages, what happens when you have extreme weather events closing pharmacies, and on a wider level, how does the climate crisis impact substance use as a whole and mental health as a whole? And I found this policy brief really interesting, but also integrations within medication considerations really interesting as well. Next slide, please. So on an education perspective, again, a ton of really great work that is happening. So I've just put there's more than this that's there, but I've just put some examples here. The coalition has environmental stewardship guidebooks focused on key specialty areas. If you're feeling overwhelmed, there's a great like kind of hospital pharmacy 101 focus for environmental sustainability that was done by Cascades and CSHP. CAPhE has a lot of introductory material on their website as well. So that also addresses these two things these two areas very nicely with regards to looking at pharmacy management, pharmacists, and pharmacy technicians. And there's also an explosion of various sessions and webinars like this one, hosted by the coalition, as well as individual courses that are out there for people who want to do work in this area. Next slide, please. I think it's important as well to think that we need to think about both environmental sustainability and climate resilience. And I'm grateful to see that education in both areas is also expanding. And finally, healthcare service delivery. We're starting to see information on the healthcare workforce as well as service delivery in general. And if we were to go to the next slide, you can see some examples of this. So with service delivery, you can look at everything from virtual care for pharmacy services to actually looking at championing services from an equity perspective and addressing health inequities that way, particularly important from a climate adaptation perspective, and then specific practices from healthcare service delivery focused on some of the areas we've talked about within emission reduction and pollution reduction. Again, very important to think about both environmental sustainability and climate resilience. Next slide, please. One really exciting playbook that was created was with CAPhE and the Indigenous Pharmacy Professionals of Canada and Cascades, which focused on equity-seeking populations, focused specifically on the Indigenous perspectives. And one thing I've been very humbled to know, to begin to learn, is the importance. I always knew that Indigenous populations were quite vulnerable from an adaptation perspective, but the importance of considering Indigenous perspectives from a mitigation perspective can't be understated. I think it's very critical to think about this area, and really grateful that the Indigenous Pharmacy Professionals of Canada are doing some great work in this area. Next slide, please. So for the healthcare workforce, we can see that there's a lot of different types of things that can be looked at in terms of healthcare system delivery. So everything from heat and case training for medication management to the integration of early warning systems within pharmacy for drug shortages, and then also simulation for things like looking at environmental sustainability, but also disaster planning as a whole. And speaking of disaster planning, if we were to go to the next slide, you can see an example of this with regards to, this is from the CBC, looking at an interactive workshop that actually does a simulation and prepares pharmacists to respond to emergency events. I think this was from the University of, so we've seen this at the University of Waterloo, and we've also seen this at the University of Alberta. And I'm seeing more and more of this happen across the country, which is very exciting. So younger students and academia certainly leading the way in this area. Next slide, please. So to conclude, yeah, I'm good for time. So to conclude, we have this amazing World Health Organization low carbon and climate resilient framework, which if you haven't seen, I would recommend looking at. It's a really nice overview of trying to merge this low carbon and climate resilient together. And then you also have the CRACCO framework by the coalition, which was led by Dr. Bhavini Goel, and that provided the framework for acute healthcare systems. And then our CAPhE-led framework, supported by the coalition through CRACCO's support, basically also facilitated multidisciplinary engagement here. And then we also have amazing targeted education in the space that can be leveraged, that other groups have focused on, and some awesome ground-up examples that have already existed. But there is very much relevance and a need to apply considerations for strategic frameworks to be able to help inform this not just on a a bottom up perspective, but also on a top down level as well, in order for things to be integrated within systems. And we're starting to also see that now through the integration of a lot of executive sponsorship of work within a hospital pharmacy for planetary health. So that is it. Yeah, despite the technical issues, we somewhat we were okay for time, which is good. Thank you.
Thank you, Shaliza. That was wonderful. Amazing, amazing work. Um, I didn't see any questions, but I imagine, do you know most of the people in the group here, Shaliza? Do you recognize some of those names? I
So
see
when I
them
was
yet.
sharing I have to just go to the
I'm,
attendee list.
I'm guessing these
Some,
are all,
not, yeah.
yeah, yeah. So if people just want to jump on and ask questions, go ahead. I don't know that I have any. I thought that was great.
Yeah, I just wanted to thank, so again, Dr. Goal, as well as the members of the coalition more broadly, but as well the specific people from CAPhE who really did a lot of work in helping to create this in a very short period of time. Like, uh, I mean, I know there's a lot of volunteer work that is happening in this space, but it was particularly inspiring to see the everybody basically coming together around this framework.
So where will you house the framework?
Yeah, so that is so we are presenting this um, at we've submitted for presentation at the International Pharmaceutical Federation conference that is happening at in Montreal. For those of you who are pharmacists, and I would highly recommend going because there's going to be representation from more than 90 countries. But I don't think we've confirmed where we're going to house this because we'll be submitting this for publication, and we have the poster that is being submitted, but where it'll be housed is TBD. We certainly will have it will certainly be on our CAPhE website for sure as well. So
This is a conference you've been to before and needed to travel, and you're saying it's in Montreal this year?
yep.
Okay, well,
So
that's pretty amazing.
this is the one. This is at the end of August, early September, and I think this is really important. I mean, I know we tend to think specifically to Canada, but there are a lot of amazing work that's happening in planetary health in various parts of the world, and in fact, we've gotten a lot of opportunities for ideas and also for collaboration across countries for various kinds of work. So I don't know. I would really highly recommend exploring it. It's at the end of August, early September. And
No, it
last year,
sounds like a great opportunity, right?
yeah, absolutely.
Um, we
Last year, I
will
saw a lot of planetary health work as well being
we will
submitted.
be putting Bavini's framework on our website. We uh, Autumn could tell you more details if you want them, but we had our website redone. We still sort of working through some glitches and design and stuff. Even though it's open and you can look at it, we don't have it quite where we want. And then we will start putting other things on it. We will put Bavini's framework on there. And look, if it works for you, we'd put yours on there right beside it. But that's only if you want us to.
Yeah. I
But
can definitely, yeah, we really appreciate, I think like the coalition has so many people from so many different backgrounds coming, and I think multidisciplinary engagement is so critical for something like this to move forward. Whereas CAPhE is generally like more of a site specifically where we see a lot of pharmacy engagement. So we can definitely talk to the team, and we'll probably do something like we've done in the past with like it being housed in both areas, basically. So, but we'll just have to talk to the
yeah,
wider.
no worries, no rush. You know where to find us.
Yeah, yeah. We we
So,
we
yeah,
do a lot of great work
great to
together.
see you, Shaliza. We need to catch up sometime soon. And
Absolutely.
great talk. Thank you so much. I didn't see any questions, so I think you're off the hook.
Okay.
Autumn, you want to wrap it up?
Yeah, thanks everyone. Thanks again, Shaliza. And yeah, thank you for everyone for joining us, to everyone for joining us today. I'll be sending along the recording and the slides shortly. So yeah, have a great day, everyone.
Amazing. Thank you.